Fatty liver is a condition that occurs when too much fat accumulates in the liver cells. It can be caused by various factors, such as obesity, diabetes, high cholesterol, alcohol consumption, or pregnancy. Fatty liver may not cause any symptoms in some cases, but in others, it can lead to inflammation, scarring, and liver damage. Some possible signs and symptoms of fatty liver are fatigue or weakness, pain or discomfort in the upper right abdomen, nausea or loss of appetite, weight loss or difficulty losing weight, itchy skin or yellowing of the skin and eyes, jaundice, swelling of the abdomen, ascites, or legs, edema, enlarged spleen or blood vessels under the skin, confusion or mental changes. However, these symptoms may not be specific to fatty liver and could indicate other liver problems or conditions. Therefore, the best way to identify if you have fatty liver is to consult a doctor and undergo some tests. Some of the tests that can help diagnose fatty liver are blood tests, to check for liver enzymes, blood sugar, cholesterol, and other markers of liver function and health. Ultrasound, to create an image of the liver and measure its size and fat content. MRI or CT scan, to provide more detailed images of the liver and detect any inflammation or scarring. Liver biopsy, to remove a small sample of liver tissue and examine it under a microscope for signs of fat accumulation and damage. If you have fatty liver, your doctor will recommend some treatment options based on the cause and severity of your condition. Some of the common treatments are lifestyle changes. To lose weight, exercise regularly, eat a healthy diet, avoid alcohol, and manage any underlying conditions such as diabetes or high cholesterol. Medications, to control blood sugar, cholesterol, or inflammation levels, or to treat any complications such as ascites or infections. Surgery, to remove excess fat from the liver or to transplant a healthy liver from a donor in case of advanced cirrhosis. Fatty liver is a serious condition that can affect your quality of life and increase your risk of developing other health problems. However, it is also preventable and reversible if you take good care of your liver and follow your doctor's advice. For more updates, subscribe to this channel and hit the bell icon.